Hello, everyone. Thank you so much for joining us. Today we're going to go ahead and get started. My name is Erin Tinnen with the National Center on Domestic Violence, Trauma, and Mental Health. Today's webinar will be Promising Practices, Trauma-Informed Approaches to Working with Survivors of Domestic and Sexual Violence and Other Trauma. Our trainers today will be Dr. Carol Warshaw, Director of the National Center on Domestic Violence, Trauma, and Mental Health, and Heather Phillips, Research Manager, also with the Center, who will be introducing 4 exciting programs today. Before we get started, I'll go over some of the technical details of the WebEx software that we will be using for today's webinar. Many of these details are explained on the Using this Webinar System tab on the upper left-hand side of your screen. Please be aware that your screen might look a little different depending on whether you're using a Mac or a PC. On the right-hand side of the screen, there are multiple boxes. The second from the top is the chat feature. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as get in contact with the trainers or myself if you have any questions regarding the training content. You may contact Jennifer Curley, also with the Center, if you have any questions troubleshooting the WebEx software. To do this, click the down-facing arrow and select the person you would like to contact. You will see a lot of options, but for this session, you'll want to select all participants if you would like to respond to a question from the trainer or contact me anytime during the session. You should click on Jennifer Curley to privately contact her if you're in need of troubleshooting the WebEx software. So let's test this chat feature. Will everyone please go into the chat box, click on all participants, type in the program that you're calling from, and then press enter. Thanks for kicking it off, Rebecca. Excellent. Folks can continue to do that while I continue the intro. While folks can get a lot out of the chat feature, there are times when it moves really quickly and can feel distracting. If this is true for you, you can feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow if you choose. We will be providing live captioning during this webinar. Below the chat box, there is a Media Viewer box. This will contain the captions. If you do not want to see the captions, click on the down-facing arrow next to the word Media Viewer, the same way you might if you want to hide the chat box. At the end of the webinar, you will be taken to a very brief evaluation. Please take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, return to the email you received with the original webinar link and re-enter the training. Sometimes the sound cuts out due to internet connection, so feel free to call in if that becomes a problem for you. If you're experiencing technical difficulties and are unable to contact Jennifer Curley, you may call WebEx Tech Support to resolve any issues. That phone number, which we will also post in the chat box, is 1-866-229-3239. Again, thank you so much for joining us today, and I will now turn the training over to Carol.
Thanks so much, Erin. So it gives me great pleasure to introduce this webinar on promising practices and model programs and have the chance to share the amazing work that both Heather Phillips, our fabulous research manager, did to gather the information that you'll hear about today and to produce the Promising Practices Report, and to hear from 4 really wonderful programs that each have so much more to offer than we can possibly do justice to in the short time we have today, and to recognize the many other programs that we know about and don't know about that are also doing very creative trauma-informed work. I'm going to take just a few minutes to talk about our center, the National Center on Domestic Violence, Trauma, and Mental Health, and how this project fits into our overall work, and then to frame today's presentation with a very brief overview of our approach to what we refer to as accessible culture, domestic and sexual violence, and trauma-informed social justice work, or ACDVTI work for short. So, as many of you know, NCDVTMH is a national training and TA center and one of the special issue resource centers funded by the Family Violence Prevention and Services Program. And while our goals seem to be continually expanding, often to everyone's chagrin, at least in our shop, our overarching goals are as follows. One of our primary goals is to improve the capacity of programs and systems to serve survivors of domestic and sexual violence and their kids who are experiencing a range of trauma, mental health, substance use-related concerns and needs. And we do this through a range of online and in-person capacity building, training, TA, and consultation with the domestic and sexual violence fields and with the mental health, substance use, legal, and child welfare providers and systems. One of the ways we've been working to improve system capacity is by fostering the development of culturally relevant responses to the range of issues survivors face in their lives. And we do this through the development of our ACD-VTI approach and by providing opportunities for people who are doing innovative work in the field to share their knowledge and experiences with others, which is part of what we're really excited about today's webinar. Another key aspect of our work is contributing to building an evidence base for culturally relevant, trauma-informed, and trauma-specific domestic violence and sexual violence work. And we do this in a variety of ways, including by conducting ongoing reviews of emerging research, identifying promising and emerging approaches and interventions, and developing tools for programs to evaluate and assess their work. And one of the things we're very excited about that we're in the process of developing is an ACD-VTI evaluation toolkit that will have baseline and outcome measures at the survivor level, the advocate level, the program level, and the coalition level that will be useful, hopefully, to all of you who are doing this work. We also have been increasingly engaged in policy advocacy work, trying to track and identify and analyze emerging policy issues that have implication for survivors and for the field. And finally, what I'll talk about next is providing an integrated trauma social justice framework for addressing these complex issues. But first, let's take a moment. You know, most of today's presentation is at a more conceptual level, but it's also important to think about how we want to engage with the information that we'll be discussing. As we know, talking about trauma always has the potential to bring up our own experiences and feelings. So thinking about why think about trauma in a broader social context? There's a couple of points I want to highlight, particularly as we think about trauma in the context of domestic and sexual violence. First, you know, the initial work on trauma focused on responding to the effects of trauma that occurred in the past. We know in the context of domestic violence that trauma is often ongoing, where survivors face continuing danger and coercive control at the hands of an abusive partner, including in relation to their mental health or substance use. That we know that partners from the coercion studies that the National DV Hotline did, that partners actively undermine their partner's sanity and sobriety, then try to prevent them from accessing treatment, and then turn around and use that against them to undermine their credibility with the systems where they seek help and redress. We also know that trauma is, so we're holding both the impact of trauma and ongoing coercion and control. We also know that trauma is not just individual, but often collective as well, and that there are not only longstanding legacies of historical trauma that continue into the present, but these legacies are upheld by policies that continue to perpetuate discrimination and structural violence. So again, we use this slide as a way to kind of help scaffold or provide a framework that allows us to hold all of this in mind as we're doing our work and thinking about how we're all impacted by the world and realities that we live in. So the other part of this equation, the other critical piece that we need to hold, is that in a trauma-informed approach, we're also part of this equation. We're also affected by many of the same experiences and conditions that people who come to us, that affect the people who come to us for services. So when we think about this, we're thinking not only about the impact of trauma on us as individuals, as advocates or clinicians or survivors, but also on the interactions that we have with each other, and how critical it is to have the kind of, build in the kind of reflective practice that allows us to understand what's happening in the moment and to be able to transform our own responses. And that relies heavily on the resources and supports we have, both as individuals. We often talk about self-care, but how do we take care of each other, and how do our organizations help support us in that process, which is another critical component. And also, what are the cultural and spiritual traditions that we draw on that also help us in this work? So to look at the kind of overall picture of what we mean by an accessible culture, DV, sexual violence and trauma-informed social justice approach, trauma-informed social justice work, from our perspective, and I know that many of you share this, is about understanding the effects of trauma and what can be done to help mitigate those effects, while at the same time working to transform the conditions that allow for violence in our world. We initially developed this kind of framework as a way to bridge trauma-informed and advocacy perspectives, but it's evolved into a framework for holding many of the key elements that are critical to doing our work and also central to the work of today's presenters. So work that's grounded in a domestic violence and sexual violence advocacy perspective, including an analysis of gender-based, trans, and homophobic violence, one that incorporates an understanding and sensitivity to trauma and its effects, that recognizes the centrality of culture and historical context, including the strengths and resources that we draw on, what's meaningful, as well as experiences of trauma and discrimination, and one that's committed to social justice and human rights, including ensuring that our services are fully accessible. So at the heart of a trauma-informed approach, we're thinking about minimizing re-traumatization by counteracting the experience of abuse through the quality of the interactions that we provide that are respectful, caring, kind, and based on a profound sense of equality, and doing what we can to mitigate the effects of abuse by facilitating healing, resilience, and well-being. That requires an organizational commitment to do this work, supporting staff and engaging community partners and people who use our services in shaping our organizations. And again, addressing the conditions that perpetuate abuse and violence. So at heart, and what we really mean is, by being trauma-informed, is embodying in our own practices and organizations the world that we want to create, which is something that you'll see that the presenters we have today really do in their own work in organizations. So I'm now going to turn this over to Heather Phillips, who will tell you more specifically about the Promising Practices Project.
Wonderful. Thank you very much, Carol. Hi, everyone. This is Heather Phillips, and again, I'm a research manager here at the National Center on Domestic Violence, Trauma, and Mental Health. So I'd like to thank everyone for joining today's conversation about promising and model practices in providing trauma-informed domestic and sexual violence services. Before turning the webinar over to the programs, I'm going to tell you about the Promises Practices Project and report. So before talking about the Promising Practices report itself, I'm going to tell you a little bit about how it fits into our larger initiatives. The Promising Practices Project is a part of our ongoing efforts to identify, assess, and share information on innovative, promising, and evidence-based practices that are relevant to survivors of domestic and sexual violence. The goal of the Promising Practices Project is to collect information about how domestic violence programs are currently thinking about what it means to be trauma-informed, as well as the ways that they understand trauma and its effects. So as part of this project, we're also interested in identifying aspects of trauma-informed services that are especially meaningful or helpful to survivors. And this includes a focus on culturally specific approaches to healing, including collective approaches and community-based practices. So how did we do this? We conducted telephone interviews with representatives from 45 programs that were identified as model or promising, specifically in the ways that they use a trauma-informed approach. This was a nationwide project, and we spoke with programs in 20 states, plus the District of Columbia. So of the 45 programs we spoke with, 30 were domestic and sexual violence programs. And of these 30 domestic and sexual violence programs, 18 have shelters or provide transitional housing services. 16 provide culturally specific services, of which 8 are culturally specific organizations. And 4 of them weren't exactly programs themselves. They were collaborative initiatives involving multiple organizations. So, for example, one of these collaborative initiatives included a state domestic violence coalition, a domestic violence program, and a psychiatric hospital. Beyond the 30 domestic and sexual violence programs, we interviewed 15 programs that support refugees or survivors of torture. These interviews were conducted by Dr. Mary Fabry, who is an expert in that field. she identified 15 programs that have been doing promising or model work in providing trauma-informed or trauma-specific services to refugees or survivors of torture. We were interested in learning more about any trauma-informed or trauma-specific approaches that could have relevance to survivors of domestic and sexual violence. For the interviews themselves, they took about an hour to complete, and they were very comprehensive. In fact, the interview script that I used was a total of 4 pages long. If you would like to see these questions, they are available at the end of the Promising Practices report in an appendix. But given the amount of time that we have together, I'm going to forego describing the questions in the interviews, and will instead focus on 3 main themes. So we asked programs about 1, how they understand trauma and what it means for them to be trauma-informed. 2, the aspects of their services that are especially meaningful to survivors. And 3, we also asked them to provide any advice or lessons learned, drawing from their own experience in becoming more trauma-informed. So how did we identify programs that are promising our model? We did this in 3 ways. First, we did this through feedback from state and territory domestic violence coalitions and dual domestic and sexual violence coalitions. So way back in 2012, we conducted a nationwide needs assessment of coalitions. In that needs assessment, we asked coalition members to offer names of programs that they thought were doing promising or innovative trauma-informed work, and that included a focus on culturally specific trauma-informed work. Next, we solicited information on promising or model programs from the culturally specific special interest resource centers. And finally, we asked all the people we interviewed whether they could recommend any programs that are doing promising or model work in providing trauma-informed services. However, given all of that, I would like to offer you one major caveat. The programs we spoke with represent an unknown number of programs throughout the country that could be considered model or promising. So you might be thinking to yourself, I know of a program that's doing really innovative work and they should be highlighted. And if that's the case, at the end of this webinar, you'll have an opportunity to fill out a survey, and there will be an item on that survey that will allow you to recommend programs. We're continuing to do work in this area, so any recommendations really are appreciated. So after all the interviews were completed, we looked at the interview transcripts across all the programs, and we compared them through doing a thematic analysis. We noticed 5 key themes that came up around what it means to do trauma-informed work. This includes carefully listening to what survivors, staff, and community members share about their experiences of trauma and about what helps support their safety, their healing, and their well-being. So many programs share that they have gained a better understanding of trauma and the process of healing through deeply listening to and considering the stories and experiences of survivors, staff, and community members. So in some cases, this has led to the creation or expansion of services based on feedback shared by survivors in the communities they serve. Another theme that emerged is that trauma-informed organizations create service environments that are responsive to the effects of trauma on survivors, staff, and communities. All of the programs we spoke with described ongoing work to create a physically and emotionally safe environment for both survivors and staff. A big part of this is taking good care to avoid any further traumatization of survivors, and this includes avoiding replicating power and control dynamics and subjecting survivors to excessive or rigid rules. Programs also shared that providing clear information to survivors about what they can expect from staff and the agency is part of creating an emotionally safe and predictable environment. The next key component focuses on the importance of providing information about trauma and healing, including information about trauma triggers, which are now what we call trauma reminders, to both survivors and staff. All programs described how they share information with survivors and staff about trauma, including its effects on individuals, organizations, and communities. Part of the point of sharing this information is to help normalize responses to trauma. And many programs also shared that as they became more trauma-informed, they came to understand behaviors that had previously felt to be puzzling or challenging as possible responses to trauma. Next, all programs described having an ongoing commitment to creating more trauma-informed organizations. All the programs we spoke with shared that becoming more trauma-informed is an ongoing and reflective process, and it's really more about a shift in understanding about the effects of trauma rather than a checklist of improvements or services to be implemented. Given that many programs have engaged in agency-wide trauma-informed initiatives that integrate a trauma-informed approach throughout the organization's culture. And finally, another key component is seeing a commitment to staff well-being as integral to a trauma-informed approach. All programs emphasized that supporting the health and well-being of staff members is absolutely central to being trauma-informed. This includes really understanding how trauma can affect staff members and incorporating that understanding into how staff are supported. So this can include, for example, some ways that programs approach regular supervision, wellness programming, and supports to address vicarious trauma. So overall, the Promising Practices report builds upon these key themes and discusses ways that programs, for example, work with survivors with mental health or substance use-related needs, or provide culturally specific trauma-informed services, or approach advocacy, activism, and prevention. And the programs who we are lucky enough to speak with next will be talking about specific ways that they have incorporated trauma-informed practices into their work. So we are very pleased to be able to highlight the work that the District Alliance for Safe Housing, otherwise known as DASH, Enlace Comunitario, the Rose Brooks Center, and Wise Women Gathering Place have been doing. I'll be turning the webinar over to Peg Haskalow from the District Alliance for Safe Housing next.
Hi, thanks Heather, and I just wanted to say thank you. This is Peg Haskalow, and I'm the Executive Director here at DASH, and we are so excited to be included in this webinar and be able to support the work that the center is doing, because it is really groundbreaking work. So I will talk with you a little bit about the DASH model of services, and I'll try to keep it fairly brief, but DASH is a reasonably young organization. I founded DASH in 2006, and our mission is to be an innovator in providing access to safe housing and services for survivors of domestic and sexual violence and their families as they rebuild their lives on their own terms. And recently we added this additional statement as part of our mission that we believe that we envision a culture where safe housing is a human right shared by everyone. And the few things that I usually highlight about our mission is that we really are focused on providing access to safe housing and services, in that we know, at least in Washington, D.C., that there isn't and probably will never be enough safe housing for survivors, domestic violence safe housing for survivors, and that many survivors end up in homeless housing programs or in other kinds of unsafe situations. And so we're really trying to ensure that wherever survivors seek housing, that it's going to be safe. Additionally, that we work with survivors of domestic and sexual violence and their families, and I will show you shortly the broad definition that we use around those issues. And that we really do believe that safe housing is a human right, and you'll see how we operationalize that. So DASH has developed a number of different programs over the years to try to meet our mission. We have a couple of residential programs. Our Cornerstone facility is our main residence, and that's a 43-unit emergency to transitional site-based housing program. It's an apartment-style program where we can provide individuals and their families with a unit of their own where they can live, they can come in crisis but live for up to 2 years while they're working to figure out how they want to move forward and heal from the abuse that they've suffered. Our Empowerment Project is a scattered site program. We have 15 units in that program where we have agreements with landlords who lease up to our clients. We subsidize their rent for a period of up to 2 years. And at the end of that 2 years, we discontinue our subsidy and the survivor takes over paying the rent and has permanent housing. And our Housing Resource Center, which is our community-based non-residential program where we do a lot of homeless prevention services, work with local landlords, property managers, city housing agencies, and homeless service providers to make sure that their programs are safe, as well as our most recent project, the Survivor Resilience Fund, which is a flexible funding program where we can help survivors with emergency financial assistance to help them avoid homelessness as a result of abuse. And then our most recent project, which is the National Alliance for Safe Housing, where we are providing training and TA to other jurisdictions around the country on how to improve access for survivors. So we've really tried to approach this issue of domestic violence and housing and homelessness from as many different approaches as possible. We really based our programs on 3 core beliefs, and this is what drove our philosophy and ultimately our model. The first belief is that we believe that housing is a human right. And what that means to us is that we really provide housing for survivors of all different kinds of violence, whether it's intimate partner violence, sexual assault, sex trafficking, same-sex domestic violence, stalking, and in many cases, homelessness. And we also work with survivors who have a variety of other presenting needs. They may have disabilities or chemical addictions or mental illness or documentation issues or whatnot. And that has really led us to the practice of using what we call low barrier access, which means that we don't screen survivors out based on what their situations are. We invite them into our programs and then work with them to the degree that we can. Our second belief is in self-determination, that we believe that one's housing stability shouldn't hinge on engagement in services, and that survivors really should be the ones to drive what programs they want to participate in and how they want to make meaningful change. And that means that we have to take a really proactive approach to working with the survivors in our programs, to engage them and build trusting relationships so that they can get the support and resources that they need. And this, we believe, results in a practice of voluntary services. And then our third belief is that domestic and sexual violence is a traumatic experience, that having experienced that kind of violence can psychologically change a person's belief in themselves and really diminish their ability to trust and hinder their ability to make decisions for themselves or organize to accomplish goals, and that it might decrease a person's sense of safety and create a sense of intense fear, so that really results in our practice or use of trauma-informed services. So with those 3 beliefs, we developed the DASH theory of change, and that goes this way. First, that survivors with complex needs, we believe, are best served by programs that are highly individualized, that they're relational and adaptable, and that the higher the degree to which programs are designed to be trauma-informed, flexible, and individualized, the less there's an ability for staff to rely on a one-size-fits-all approach, that they really have to be able to work with each survivor where she is depending on her situation, and that therefore staff require an equivalent degree of autonomy and support and skill building in order to best meet the complex needs of survivors. So based on that theory of change, we created this model, and this is the model that we developed early on when we were first forming DASH programs as a framework to help us figure out how we wanted to work with individual survivors, how we want to support our staff in doing this really difficult work, how we wanted to build out our programs, and really just how we want to make decisions as we're moving forward with the organization. So we created these 7 principles that really articulate for DASH what we believe are important in doing the work. Those principles are sovereignty, integrity, empowerment, compassion, accountability, and partnerships. And that those principles are all centered or all framed around the issue of recentering. So let me go through what each of those principles means so that you have a better understanding. Sovereignty for us means having the freedom and responsibility to determine what's right for yourself and to be self-governing. Integrity is behaving consistently with the values you promote, striving to know yourself and behaving authentically. Empowerment is about owning and giving voice to your own power to get your needs met and helping others to do the same. Partnerships is about having mutually cooperative and respectful relationships with those with whom you interact, and that means members of the community, residents, your coworkers, members of the board, whoever. Accountability is about being responsible for maintaining ethical standards and clear boundaries in the course of daily interactions. Compassion is having empathy for others who are vulnerable to help them get their needs met and being able to do the same for yourself. And then finally, recentering, which for us is the process of negotiating change, conflict, and challenges in order to find the balance to move forward in the way that you want. So as I said, those principles that we use are all framed around the issue of recentering. And what we acknowledge is that there's always going to be push and pull among those principles as we do the work, as we're faced with conflicts or challenges or changes that many of us have a tendency to lean on one principle or another. Some of us may be more inclined towards accountability. Some of us may be more inclined towards compassion. And that often if we're faced with an issue that we're having difficulty navigating, that it's because we're out of balance in considering those various principles. And so the way we use the model is to consider the ways in which we need to restrike that balance. What haven't we given enough attention to in addressing that situation, and how can we rebalance those different demands so that we can find a way forward that is meaningful for us? And that's really the process of the model, is that it's a process that's ongoing that's helping us figure out how we move forward. So the other part of the DASH model that's really important is that as we use this model that can be very process-oriented and can be very nebulous, and in a lot of ways doesn't provide our staff with the comfort of relying on a lot of rules and policies around how to work with survivors, we really feel that it's important to have a management structure in place to provide our advocate team with the most support possible. And so we really see our advocate team, which you see is at the top of our management structure, as being the people who are on the front lines doing the really hard work. And all of the rest of our staff are in support of the work that the advocate team is doing. Under them is the program directors, and those are the people who provide administrative supervision and support in just implementing program operations. And then we have our technical assistance team. And these are our clinical director and our addiction specialist who provide the advocates with a degree of clinical supervision so that they have the opportunity in working with survivors and using the model to be able to think through clearly with skilled professionals in how to do that in a way that is safe and trauma-informed. And then the rest of our agency staff, our deputy director, our admin team, our property manager, and myself are all really here to support the work of everyone else, in doing our programs. So I'll just keep this quick. We did do recently an evaluation to understand if the model was having the effect that we had hoped. And so we engaged researchers from Dr. Chris Sullivan from Michigan State University to conduct an evaluation of the model in order to understand how the model influences our organizational practice, the extent to which employees engaged with residents in a way that aligns with the model, and then to determine whether those practices really led to residents feeling more empowered and safe. And, without going through all of the results of the evaluation, which I can certainly share with anyone who's interested, we did find that the DASH policies and procedures were in alignment with our core beliefs, that our cultural norms and our flexible policies support the use of the practices that are derived from our model, so that basically we are acting in a way that's aligned with the principles that we espouse. And consequently, that the greater use of the practices that reflect our model, the more likely clients were to report empowerment. And the more likely also that they were to report feeling safe and self-determining. And finally, that these relationships were statistically significant, even when considering how frequently the survivor engaged in organizational programming or the length of time that they had been residing in our program. So that basically it didn't matter how long or how many the participants had been in our program or how many services they engaged with, that they still reported feeling more empowered and safe, and that the DASH model ultimately was deeply ingrained in our organizational context. So we were happy about that, and that's all I have, and I'll be happy to answer any questions at the end of the webinar, but I'll give this back to Heather.
Thank you so much, Peg. Next, we'll be hearing from Virginia Perez Ortega from Enlace Comunitario in Albuquerque, New Mexico.
And I work for Enlace Comunitario in Albuquerque, New Mexico. We serve the central New Mexico area. Our program is based in Albuquerque again, and so we're very close to the border. We get to be very specific and intentional about working with Spanish-speaking immigrant community. We are a social justice organization led by Latina immigrants, and that's how we define ourselves. Our mission is to eliminate domestic violence and also foster work to create healthy families in the Latino community. So we do this by two different things. We provide a comprehensive menu of services for victims who have been, or for families who have been affected by domestic violence, but we also engage in preventative community education. We do a fair amount of policy advocacy and leadership development. So with that, I also want to make sure that we will let all of you know that we work with all survivors of all types of families. We don't define the families by just the nuclear family. And so I am really pleased to be part of this webinar. Enlace is, I believe, one of the model organizations because we are community-led. It is always community-informed. The concept of being trauma-informed is something that we've been practicing since the organization was created in the year 2000. So, again, the services that we provide are intended to raise awareness about domestic violence, and we do this. One of the things that I'm in charge of, and I'm very proud to be sharing with you, is by engaging the community, engaging, first of all, survivors, victims of domestic violence, and we also work with allies. That could be white allies, that could be men who recognize the harm of domestic violence and how they can come on board and help us accomplish our mission, basically. So our community engagement identifies ways to eliminate domestic violence. We provide mostly the space for that to happen. And so, again, we are a 15-year-old organization created in the year 2000 from the ground up. We basically have been working from practice instead of evidence to practice. We are one of the programs that works from practice to evidence. About 4 years ago, 3 or 4 years ago, we were fortunate. We were chosen by the Robert Wood Johnson Foundation to conduct a study, to conduct an evaluation, a 3-year-long evaluation of our Promotora project. And what the Promotora project is what I'm going to be talking about the next 10 minutes or so. But basically, the Promotoras are the survivors. They're the survivors who have come to services. They find that they have helped themselves, that they have advanced their life, and they cannot move on without helping others. And so we have listened to them and created this wonderful, amazing program. But before we go, I go into detail about the Promotora program, I want to share our theory of change. Our theory of change, if you can see, it's a graphic, it's a visual. We like it this way because it shows how we don't work in a linear way. It's not like the survivor comes or the victim comes in a certain stage and then it has to move in certain programs to be able to succeed. But it is rather a circular. It's a circular approach. It's how our community works. Our promoters are at the center. They do, by the most part, inform and guide everything that we do. So starting from the bottom up, we attend, again, to the needs of immigrants affected by domestic violence. And then what we do, and we attempt to do is remove the guilt from them that they have been feeling, and find a place for them to receive services, whether it's internally or externally. So we connect them to resources. After they have received the different types of services that we provide, they may join or apply or join or get integrated into our Promotora program. And then they become the leaders. They become volunteers, receive an extensive training. And as you can see, our ultimate goal is for them to be engaged and work in coalitions, networks, and ultimately change the social norms. So we know that the prevention work is a long-term, generational, multi-generational work. We still chose to do that and to devote resources and intentionally do that. So I could go on and on talking about this theory of change, but let me explain to you some of the things that we offer. The intervention services include crisis intervention, case management, the safety planning, sitting with the person, the victim, and going over what are the options. Because we're very close to the border with Mexico, we face a lot of unique challenges, and in which we have to help our victims. We help them secure housing, food, clothing. One of the newest programs that we have includes transitional housing, therapy for children, for the family, and so as necessary. Some of the things, the most popular things that we have in the intervention program is the offer of support groups. Because immigrant victims are very isolated, they find a space and a safe place in the support groups. So that hand on hand with the individual counseling for adults and children, family counseling, we also have a legal department that offers court accompaniment. We would go with the clients to hearings, and also representation on family law matters. We refer, of course, to a lot of organizations, and we partner with a lot of programs and organizations that offer some of the things that our population is asking for, such as English classes, or they may be immigration law, other things that we are not integrating, we don't have here at Enlace. We work with other agencies to get that done. On the prevention program, we have intentionally, since 2008, invested in the prevention programs, because Enlace, as I mentioned, started from the ground up, and it would be growing. We added a case manager, and then we needed to add a therapist, and then we needed to add an attorney. And it was growing in an outrageous way. It was kind of sort of scary. And so the board, staff, clients, everyone said, what are we doing? We can continue adding services, and this is not going to stop. So let's take a pause here. Look for resources and invest in prevention. And so with that, we had tens of, if not hundreds, of survivors who were asking for more tools and for more training to become our promotora. And so we created the promotora program. And similar to promotora, we created a youth leader program. The youth leaders is a group of youth who may have received directly or indirectly services from us, or their parents or someone has been involved with us. And so we also train leaders, youth leaders, boys or men and women, to become the youth leaders and to go on and train their peers. We also have the Promotores program. It's the newest Engaging Men initiative that we have, and this one is actually progressing, but again, given the limited amount of time, I would not go into the Promotores at this time. In terms of family prevention classes, we offer healthy relating classes in Spanish, where we provide child care, where we provide a meal, and it's just what works for the community. We listen to the community. Listening to the community is one of the most important things we do, one of the most important lessons that we would want to share with anyone in the field, just to listen and really trust the community, because that is what being trauma-informed means. Like, what do the community needs, rather than expecting the community to be where you would want them to be. But in regards with the focus of the Promotora program, this is very unique. We are, as far as we know, the only one in the nation that works with survivors and trains those survivors or clients or however they define themselves as the leaders, the volunteers. We provide a 5-Saturday training in the fall every year. And this Promotoras, it's a group of, I don't know, we try to make an average of 10 women to participate, but sometimes it varies 8 or 12. That's what's manageable. And so we engage these women, powerful women, who come to learn, but most of the times come to teach us, come to teach the staff and the professionals and the service providers about what it is that domestic violence did to them, what their experience was, and how to help others. So again, they receive the training, the intensive training, and they become volunteers, commit to 1 year of services, and their main purpose is to go on to the community to prevent family violence. They do that through setting up information tables. They do that through providing presentations at schools, at churches, and at diverse places where they get asked to do. This is an example of, this is the active cohort. Our Promotoras 2016 completed their training in November of last year, and here they are very proud, holding a rose and a diploma. And so this happens every year. We have a new cohort every year. If any of you, any of the audience or anyone would like to learn more about this specific Promotora program and how we do it, including some recommendations and how to get started or how to make one, go to our website. It's listed on this slide. It's www.enlacenm.org, and then go to What Works, and you'll find a case study and more information if any of the audience would be interested in looking into that. So basically, we found out through the evaluation that yes, we are, as intended, building social capital on the Promotora. So through the intervention services, we provide that space for them to find their own inner power, as it was mentioned before, offer survivor training, become community leaders. They reach out to the community, and they go on to, you name it, either work at another organization that may be, more where their passion is, and so that's usually what happens. We also have, I'm very proud to share that we have some Promotoras that have become staff. They go through the process, there's an opportunity for employment, they apply, so we have several of them. Some of the things that we found during the evaluation that I'm making reference to is that they are very qualified to share their stories. All we have to do is guide them, help them, support them, whether it is with therapy, whether it is with materials, whether it is with a phone call, or however we need to do it is support them. Sometimes they need counseling, sometimes they need intensive therapy, sometimes they need mental health. They need to take a month or 6 months or a year away to focus on whatever's happening to them, but it has to come from them. So sharing their stories becomes one of the tools. Some of them share them, some of them never do. One of the things that we also have noticed is that the sense of group identity feels like it's something that they really, really embrace. And so when the Promotora, when a client may come here, may be isolated, but by the time they go through the process and become and complete the Promotora's program, they feel like they belong. They feel like they contributed and that their contribution is it's really part of a bigger solution. One of the things we basically have developed the training as we go, but it includes a lot of the professional development because that is what they want. They may want to go to school, they may want to obtain a job or get some kind of certification to focus in one area or another one. So we are going to provide opportunities, ongoing all the time, whatever is being necessary. One of the things that has shifted in the mind of not only the promotoras, but all of our prevention volunteers, staff, and board is, again, focus on the domestic violence as a social problem, not as an individual act, not as something that can be solved within the family or within themselves. And since I'm a little bit over my time, I apologize for that. I'll just finish by showing more pictures of our promotoras, of our generations. We all know that a picture can speak 1,000 words. So this is one of our initial promotoras cohorts. And here is the generation 2015. This generation has been historic because they are really not forcing, but informing enlace that we need to create a non-therapeutic domestic violence group, something where people can drop in and out, and without having to go through an intake process or the process that may take a little bit more of a systemic involvement. And so we are looking for ways to provide that services to our community. This is also an example of how our promotoras have moved and transformed our organization. The picture that you are seeing right now is of an event where we celebrated the 15th years, and in Mexico and Latin America, turning 15 is a life-changing event. And so something that may not be very culturally, something that is very cultural in Latin America, but may not be very positive, turned into a positive event. And so we created that, we provided that event in November, and that's a picture that captures like most of the attendees there. This here's more involvement in programs and in public. Of the No Mask campaign, we adopted that during the Quinceañera event, and also celebrating 15 years of Enlace, celebrating and taking into account an opportunity that is very valuable to the Latino community. And so with that, I want to say thank you for having me, and really get involved. It's our slogan is we cannot do it without the community. It's just we owe ourselves to the community. And thank you so much for having me here.
Wonderful. Thank you so much, Virginia. Next, we'll be hearing from Lisa Fleming from the Rose Brooks Center in Kansas City, Missouri.
Hi. Thank you, Heather. I'm going to go ahead and just a brief overview of the services that are provided by Rose Brooks Center. We're a 100-bed emergency shelter for survivors of domestic violence and their children and their companion animals. We operate up to 25 service up to 25 families in our rapid rehousing program, have community-based advocacy services in 6 hospitals, the police department, local courts, school violence prevention program that offers year-round support groups in 32 schools in the Kansas City metro area, offer individual and group therapy services, and have an economic empowerment program. What I'll be talking to you today is about how we've gone about implementing our trauma-informed care plan and some of the key areas where we've done work. I should start by saying that in implementing our trauma-informed care plan, what we did was that we applied lessons learned from our Office on Violence Against Women funded initiative to enhance accessibility for survivors with disabilities. Much of the things that we did there, we knew that we could transfer over to this initiative. The key lessons there being that to successfully sustain any model or vision that we would have within our agency, that it's necessary to integrate those things into policy, practice, communication, environment, and the overall agency capacity. We also, in starting this plan, we started with an extensive needs assessment that was conducted with every agency staff, and so no matter what the position, everybody had voice and choice of being able to assess where we were, where our strengths were, where there were areas for improvement, and weigh in on what would be the priority goals, and then also getting the voice and choice from survivors by doing multiple support focus groups with them. The key areas of the plan that I'll talk about today include training, personnel operation and operational policies, what we call support planning, the intersection between trauma-informed care and universal design principles for accessibility, and an organizational response to vicarious trauma or secondary trauma. This first area of training, I think that's where a lot of agencies start, and that's really where we started when we wanted to become very intentional about being a trauma-informed agency. We were able to secure funding to send all of our staff. We partnered with another local domestic violence program and a child advocacy program to get monies to send all of our staff and adopt the Risking Connections Trauma and Care Form model, and then be able to select staff within staff to have them be ongoing trainers. This is something now that all staff within the agency participate in that 20-hour training. We do trauma-informed care principles in policy and practice that is attended by all staff so that staff can see the general overview of the principles we've adopted and see how we have put those into practice in our policy, We've also done the offer a training with the intersection between trauma-informed care and the universal design principles for accessibility, and that's that merger between the trauma-informed care initiative and the work that we've been doing on accessibility for survivors with domestic violence, and it was just a natural fit to bring those two together, and I'll talk more about that in a moment. We also have all staff, we have attend a 3-hour introductory training on trauma stewardship. The actual name of the training is Trauma Work and Its Impact on You, to help staff and volunteers and students better understand the impacts of trauma exposure, what vicarious trauma is, and how to reduce its impact. We also share in that training ideas for reducing the impact of vicarious trauma, and then it's also an opportunity to each staff can create an individualized support plan. The Stages of Healing training highlights our trauma-specific model and assessment tool created by Reen Rennick and Carrie Smart, former employees of Rosebrook Center. This model emphasizes the importance for survivors regaining a sense of self in the healing process as an essential protective factor. We do ongoing training and support on the process support plan with survivors, which I'll talk about. And then most recently, we've been able to secure funding for trauma-specific trainings and curriculums, including EMDR, trauma-focused cognitive behavioral therapy, and the trauma recovery and empowerment model. In regards to our personnel and operational policies, I always think that this is really how we keep things sustained. And the thing I like about policy, and I tell this to whoever will listen to me, is that policies are great because they are the things that you can have the most profound impact that will improve the lives of survivors and your workforce that really don't cost any money. So one of the most important things that we've done is that since at least 2007, Rosebrook Center has implemented voluntary service participation for shelter residents and housing residents and anyone in our non-residential services, and significantly reduced shelter and program rules, including making sure that we had policies and practices that would screen in survivors rather than screening them out. We consider this essential to upholding trauma-informed care principles of voice and choice, safety, and empowerment. with our personnel policies includes Rosebrook Center's commitment to trauma-informed care principles. These are the things that guide our work, and those were principles that were identified and selected by staff at all levels of the organization. We also require training on trauma-informed care for all staff. It's a part of their job description, a part of their performance evaluation. Our job interviews, questions, our job descriptions, our performance evaluations include responsibilities and core competencies that are related to the support of our trauma-informed care initiatives and using a trauma-informed care approach to providing services. In the last year, we've also integrated in and updated a harm reduction model for survivors who are participating in our shelter program and housing program so that we can help support their healing and their recovery for those persons who use or abuse drugs or alcohol as a way to be able to cope with trauma. In regards to support planning, basically this started in recognition that in offering individual and group therapy services, we knew and we learned from trauma survivors that even though it's very helpful in the healing process, for some survivors, it's just there are barriers to them participating in the individual therapy services. For some, they will seek out other ways of being able to heal from trauma. For others, there's a stigma, there's a fear, there's an uncertainty. We have, they come into services and maybe have not been able to have developed that trust and rapport with our staff. So in consideration of ways to be able to engage survivors in therapy services and looking at other helpful ways of supporting trauma survivors, we were able to develop a program design and secure funding from a local funder to implement what we call support planning. Basically, a support plan is an emotional safety plan that's developed in partnership between a survivor and any direct service staff that helps the survivor set out in paper, or it can be written, to be able to basically answer these questions, and that would help the survivor be best prepared when they might be triggered by a traumatic event, and for staff to be able to know how best to respond. So answering questions like, I feel stressed or scared or upset when, and filling in the blank. You can tell when I am stressed or overwhelmed. It helps too. This is how you can tell, to be able to identify what helps, and I think just as importantly, to be able to identify when I am stressed, upset, or overwhelmed, what does not help, because it may be our intuition or our natural instinct to provide one type of support to a survivor, but it certainly is not. This is not a one-size-fits-all, so we really want to know what's not going to help that could possibly be re-traumatizing. And then be able to, the survivor would identify those people that he or she feels safe to go to for support. Other things on the flip side, and this is actually a template, and on the flip side of that support plan template gives a definition and a list of possible triggers to help aid in that educating about what are trauma responses, what are possible triggers, and to think that through. Signs others might notice, and so then we have a different list of different behaviors and observables, and then healthy ways to feel calmer and safer. And with that, we include in that list many of the different things that we have incorporated into our shelter and non-residential services environment, including an on-site gym, being able to shelter companion animals, offering yoga and meditation and Pilates, and having calming rooms available to survivors and to staff. To support this and to sustain our support planning, we've recently created an advocate guide to support planning that maps out the process for support planning and gives vignettes of how to go about doing support planning. We've adopted 2 therapist positions to become a hybrid position of a support plan specialist/therapist, and their role is to actively engage with shelter residents when they first come in and throughout their stay, to be able to come up with that emotional safety plan in a non-threatening and a non-stigmatizing way. We've created a support plan template that's used for adult survivors. We've also put that into Spanish, and we have one available for children of different ages. We routinely encourage staff to develop and share their own support plan. We think that by staff having their own plans, they're going to be better prepared to be able to share it with survivors and to be able to use that within their own trauma stewardship. And as I said, we've been able to secure and get renewed funding to have the support planning as an allowable service category for one of our local funders. The next area is what I just described as that intersection between principles of trauma-informed care and universal design. And this is a whole other training, and I would love to, if you have any interest in talking about trauma-informed care and universal design, you have my email address on this PowerPoint. I'd be happy to be able to give you more information. But essentially, we've put these two abstract ideas together. So you have on your left-hand column the primary trauma-informed care principles of safety and choice, and empowerment, collaboration, and trustworthiness, and universal design principles, which what it comes down to is designing for the widest range of users and the widest range of situations so that everybody can use your services and you don't have to have special preparations. And here's just a list of the different principles that go along with universal design. Now, in teaching this and being able to share this and integrate it into policy and practice, here's an example that we use in a handout that pairs up safety and having that principle throughout the organization, staff and the people we serve, both physically and psychologically safe, and our physical setting is safe and interpersonal interactions promote a sense of safety. Matches up very nicely with the universal design principle for tolerance for error. And in this principle, the design minimizes hazards and the adverse consequences of accidental or unintended actions. When you put those things together, our safety and the tolerance for error has resulted in design and focus within our service setting. Things like having good lighting and clear lines of sight are going to reduce hazards, but it's also going to create a sense of safety. Having respect for personal boundaries, certainly having fewer rules for survivors is going to lessen the chance of negative consequences. And if you've worked in a domestic violence program that had lots of rules and you had to be the advocate meting out those consequences, you can understand that it should never be that somebody breaking a rule would have to be exited from shelter and lose their safety. Access to exits, including things like physical safety of being able to leave a building, but also things like ending services without consequences to safety, and certainly privacy and confidentiality are just examples of how we've merged those two principles together. And the final thing that we've paid attention to in our trauma-informed plan is this principle of working with survivors of trauma affects the person of their helper too. And in our personnel policies, we talk about vicarious trauma being inescapable. It's not if it happens, it's when it happens that we will be impacted. And that this partnership of that, yes, it's everybody's personal commitment to addressing our own vicarious trauma, but we firmly believe that it needs to be supported by the organization. Some ways that we've gone about doing this include, as I've mentioned, we do the staff training on vicarious trauma and trauma stewardship. We've added into each supervisor's job description the job expectation that they would educate and support staff about the risk of trauma exposure and how to manage its impact. We have, I'd say, a pretty robust wellness program and an active wellness committee. Things that we include have a fitness challenge that is available to all staff, and by participating in that, they can earn time off. The on-site gym, we have a walking track, yoga and Pilates for everyone, meditation for survivors. Almost at any given time, you'll find a department will be doing a book club, discussions on trauma stewardship, which is one of our favorite books by Laura Vandernoot-Lipsky. Incorporating that reflective practice and supervision, creating those safe spaces for advocates to be able to talk about the impact of trauma exposure. And then also we created a guidebook on responding after a safety or traumatic event, and that's to help guide how we could go about supporting staff and survivors when bad things happen, because that will happen. So those are just a few of the things. Thank you so much for giving me your time, and I look forward to hearing from others who have ideas on practices and policy that we can incorporate here at Rosebrook Center.
Wonderful. Thank you so much, Lisa. And finally today we will be hearing from Alice Genador and Beverly Scow from Wise Women Gathering Place in Green Bay, Wisconsin.
Hi, greetings. We're so grateful to be here and to be present with all of you. Wise Women started as a group of women around the kitchen table with children in tow to learn about midwifery. Alice is a traditional lay midwife who has supported over 750 babies be born into this world, and she has mentored others like myself on the journey to be a midwife as well.
This is Alice. Thank you, Bev. And it is my belief that in all communities around the world that the midwives were known historically as the wise women of the community. Those are the people that everyone came to for counsel and help to find herbs, medicines, parenting advice, marital advice. From cradle to grave, these women supported the communities. Midwifery was not just about birth. It was about lifelong issues, helping people through difficult times. And the word actually means with woman. It doesn't really mean anything about birth. So that's one of the things that I think is kind of a founding value that we have here. The midwives were sought out by the community for every issue that we work on in this organization as well. We founded in 1998, and already even before that, we were being sought out from our community to come and help with difficult issues that they were dealing with. We now consider ourselves to be leading the broader role of a community midwife. Don't catch babies anymore so much, but we are helping people through difficult issues, and that includes, you know, domestic violence and sexual assault. I believe that midwives were historically the original domestic violence shelters and the sexual assault service providers. Those are the people that people ran to in times of need.
So when we formed formally as an organization, Wise Women has become a continuation of our kitchen tables. People are welcomed in as if it's our home. We always have coffee, tea, water, and a listening ear available. There are comfy couches, a serenity room for privacy, tot spot with mother's helpers, while caregivers can watch from a closed-circuit TV screen to ensure their children are safe. The give and take food bin is decorated by the women's group, is more often full than empty, helping each other out in a pinch. As space gets sparse here, some have suggested removing a couch, but Alice knows their full value, and it stays, not only for our community members' comfort, but for staff, when you need a rest, it's there for us too.
We are a nonprofit community center where all people are welcome while providing Native American and midwifery approaches to our community. While being a resource for the community members harmed by domestic violence or sexual assault, since our beginnings, Wise Women has been funded to provide transitional living program and domestic violence abuses since 2007, as well as funded from an official sexual assault service provider since 2013. Our strengths are in providing prevention, outreach, personal advocacy, and healing around domestic violence, sexual assault, and historical trauma. And it is my belief that this is similar to how midwives operated historically.
Oh, I'm supposed to change slides. So that was our mission. Some of the programs that we provide is our Healthy Relationship Program that Alice is the author to, our Discovery Dating program. We have Wise Youth, a very engaged group of middle schoolers and high schoolers. We have a White Bison healing program, and the advocacy services that all of those programs offer. The values, our core values, center around the needs and wellness of the person coming for support in their time of need. Even when it seems like the person is in self-destruct mode, we recognize at their core they do have their own best interest at heart. They may be exhibiting some survival reflex responses that are not so beneficial in the moment, but that has been what has been their resiliency to survive to this point. We see our role to offer more skill sets they can draw from to more likely get their needs met, to be their mirror and reflect with them on their journey for maximum awareness, learning, and healing. Informed choice is about a truly fully informed choice. We are very careful to not only offer the information we think is good for them, as we recognize this is a manipulation. We want to emphasize trust-building behavior. We recognize I may not be there in their life 5, 10, or 15 years from now living with the consequences of the choices. So we share what are all the risks and all the benefits of all the options that we know of, and let them know there may be more out there, but we'll do our best to give them the fullest landscape of choices for them. This really lays out a lot in our transitional living, our DVSA services to the voluntary services is a foundational part of our transitional living program as well. The value of protect and preserve, wholeness, and integrity is reflected in our prevention work in that we don't assume all youth are doing it. We let the degree of detail to talk about in any of the at-risk topics, we let that emerge from the group. With our discovery dating program and our evaluation, when it comes to like, have you had sex? Or have you, and then the next questions, if they say no, we just have it skip over to the next series of questions and where they're not continually asked how many partners or at what age and all of that. In regards to the people coming to our office for services, confidentiality is valued and practiced by all staff in its ideal as far as we can see. Native communities are very small. People know a lot of each other. And we have Native staff from the community that work here, and we have some non-Native staff from outside the community working here. We let people choose who they feel most comfortable, or if they feel there could be a conflict of interest, we let them have that sense of safety with who they have. We have time-limited specific waivers for agencies we work with around a particular issue with a program participant in need. It slows us up sometimes, but it builds trust and more relationship building with people in the long run. That is key. When needing to coordinate and communicate about an individual, we use private spaces. We use their initials when we're talking with each other about someone. This keeps confidentiality at the forefront of our minds so that when we are in a setting with other people around, it's a habit to use the initials and a name doesn't slip out, because it really is so important that people can feel safe coming to us. There's a lot of harm from past experiences with social service agencies in our historical relationship as Native people, from residential schools to when our children were taken from us in the 50s with foster care. There's a big distrust for social service agencies, so it's really important for us to ensure that trust is there. So Trauma Rocks, this is a great activity that was shared with us from Corrine Sanchez from Tewa Women United in New Mexico. And what she did is she has this visual of these 7 bags of rocks representing 7 generations. And she shared how the historical trauma that her great-grandparents, the historical oppression that her great-grandparents endured, and how the resulting trauma was passed on to the next generation, her grandparents. And then her grandparents endured another form of historical trauma to add on to the trauma rocks that were passed on to them from their parents. and which were then passed on to her parents and then to her. Some of the rocks are let go along the journey through our wellness ways and our traditions and other resources and our resilience in life. The hope is that as time passes, we will pick up less trauma and are able to gain more healing to let go of many more as well for our children, our grandchildren, and our great-grandchildren. We think the foundational aspect to providing trauma-informed care is really understanding that every person who walks in our door or calls is carrying their own load of trauma rocks, some heavier than others, some generations old, some very recent, but we are all carrying our own combination of trauma rocks.
Yes, and we're all on a healing journey, and as individuals and as communities towards healing from all of these traumas. This healing journey includes each of us as a staff, volunteers, and community members participating in our programs. Wise Women has the intention of open communication with each other on personal and work needs. At the very beginning of every staff meeting, we do a constructivist listening process where each person has equal time to share and check in how we are doing. This allows the rest of us to be more sensitive and encouraging as needed for each other. We strive to be flexible with staff to allow interest or passion areas to be pursued as best we can, and also to allow staff to attend to family needs. Staff development trainings are encouraged, and our roles can flex or shift between grants to allow for people to express their passion areas. In our proposals, we kind of work them up as a group, and we work to align these into our future grants as well. All of the work that we do at Wise Women Gathering Place, every single program was developed, started, or sought out after we were approached by our community for help on that issue. We believe that this effort keeps us alive in our work and prevents vicarious trauma when we share in that way.
So there's many wellness ways within Native traditions and cultures that we support and draw in and nurture. We try to offer White Bison, Mending Broken Hearts, Healing from Unresolved Grief and Intergenerational Trauma every quarter as a 4-day healing event. It is always at capacity. There's always a waiting list, and it's mostly just word of mouth from people who've attended. We have community members coming back to be co-facilitators to give back and support others. Sometimes people come to Wise Women through interest in our sexual assault group or a women's group or men's group. Sometimes they come to White Bison as their first group, and then they will spin off and get involved in some of our other groups that we have. So we really strive to be flexible in offering our programs in a way that meets the needs of community members and building trust in a variety of ways so they feel safe enough to try another way for healing.
I just want to close by reading to you our ultimate goal, the long-term vision for Wise Women Gathering Place, and that is a community of individuals and families who possess motivation, knowledge, resources, and skills to peacefully co-inhabit their environment, each having the individual sense of safety, opportunity, fulfillment, and belonging, and each fully committed to sustaining these values for every person, for all time. Transformation is in the works. Thank you all for everything you do.
Excellent. Thank you all so much. I want to take a moment to express deep gratitude for all of the presenters on today's webinar. Thank you all so much for sharing your work with us today. Thank you to Caption Colorado for providing today's captioning, and thank you to Jen Curley for making the webinar run so smoothly. Last but not least, thank you all for spending your time with the center today. Within the next week, I will send you all a follow-up email with a link of the recording of today's webinar, in addition to the slides and handouts that were referenced, all of which will be available on our website. I will also include the presenters' contact information if you want to follow up about any of their specific programs. You will also receive a certificate of attendance for your time today. At the end of the webinar, you will be taken to a very brief evaluation. If you could please take a moment to let us know what was useful and what could have been better, it would be greatly appreciated. Thank you all again, and we hope you have a wonderful afternoon.